to our other focus, because while the Omicron wave is building up, it is on the decline in South Africa. It's building up in India, it's on the decline in South Africa, the country where the super mutant originated. After a record high of 27,000 infections in a 24-hour period on December 30th, the country has now reported 15,424 infections on January 4th. So the numbers have drastically come down and suggest that South Africa, where it started, is past the COVID peak. What does all of this mean? In real terms, how should one interpret the South African solution? Hospitalizations low and the wave peaking and coming down equally quickly. Are these good signs? How should we interpret them? Well, joining me now is a very special guest. I'm joined by Dr. Angelique Coetzee. She is the head of the South African Medical Association and one of the persons who first detected Omicron. Appreciate you joining us once again, Dr. Coetzee. Would I be right in saying that in South Africa, the Omicron wave has peaked in about 3 to 4 weeks from when you first detected it and has declined equally sharply within about 6 weeks, ma'am?
We see that it's starting to decline. Remember, clinically, we already saw the virus. The first clinical patients started to come in the week of the 18th of November. And if we look at our latest stats or released yesterday, we can see that our number currently for the day before yesterday was 3,232 with an 18.6% positivity rate. Our hospitalizations also come down to 127 for the day before yesterday. So if we look at our numbers, yes, it seems as if we are past the peak and our numbers are definitely coming down. However, we need to watch the space for the next week to 2 weeks because our schools are reopening next week. And if the week after next week still low numbers, then we can say safely that we are definitely out of the, or going down and nearing the end of the fourth wave.
Okay. A fourth wave, I know, in South Africa, third wave in India. Also, Dr. Coetzee, can we be clear that most of the symptoms have remained very mild right through? There was no stage during the wave in South Africa where the symptoms changed?
Majority of patients' symptoms still very mild. Mm-hmm. Those patients who started to show symptoms of pneumonia, also it's not the same prominent type of pneumonia that you would have seen with Delta. You know, they do have their tiredness associated with the cough. Once if they start with the pneumonia, that's normally around about 10 days. But again, it's the minimum of people having a pneumonia type of infection. It is out of 116 patients that I'm standing currently on, only 3 had been admitted. And today I made a diagnosis of another person who had pneumonia.
Right.
But again, not severely enough to be admitted. So we're still busy with chest x-rays and blood tests to determine what we're going to do with her.
So the good news is out of 116 patients that you had, only 3 you're saying had condition that required hospitalization, because that was my next question. Was there ever at any stage in South Africa, or has there been pressure on hospital systems or indeed on oxygen supply during this Omicron wave?
No, never. Definitely not on oxygen supply. We've got 666 hospitals treating these COVID-19 patients. And if we look at the highest number of these COVID patients in ICU, that was around about the 17th of December. We had in hospital 7,932 people, of which around about 500 were in ICU. While on the 14th of July with Delta, we had 17,000 people in ICU, in the hospital, with 2,597 in ICU and high care. So our high care and ICU numbers a lot. Even our
But
numbers released the past few days. Again, yesterday's numbers, speaking to the day before yesterday, hospital admissions 127. And death rate is 87%, 87 patients. If we look at the data of this on the 2nd, we had 27 admissions. So it depends, but it's very seldom a lot of patients that's been admitted on a daily basis, and our death rate very seldom goes over 100.
okay, so that's the good news. But remember, ma'am, South Africa is a much smaller country than India. So even about 2% of those infected in your numbers that I saw this morning seem to have been on ventilators. In India, because of the sheer scale, that could become a major strain on the health infrastructure, is it not?
I don't think so. We know that the people mostly in ICU that's on ventilators are patients that's been unvaccinated. Mm-hmm. And so it is important to get as much jabs as possible in people's arms to protect them from severe disease with admission. Although the virus escapes your immune system, we can clearly see that you are still protected against severe disease and hospitalizations. As even those 3 patients that I had admitted, all 3 of them has been vaccinated, and none of them has been ventilated. Mm-hmm. 2 of them has already been discharged out of hospital. So we just need to treat patients as with mild disease out of hospital as much as possible, and people need to go to their doctors, go and get healthcare the moment when you get symptoms. In that way, you will prevent them from progressing. So, because if their blood pressure is uncontrolled or the sugar is uncontrolled, you can at least try to assist so that they don't progress.
But broadly, you're telling me that even on ventilators, there was no pressure on your systems. The worry, of course, Dr. Coetzee, is that there are many more variants out there. We've just heard today of a new variant in France that has its origins in Cameroon that is fast mutating. Is that the worry, that Omicron may not be the end of it, particularly variants coming from Africa, ma'am?
I'm currently not really aware of that variant and what the clinical symptoms are. Of course, that's always the question, is what is the clinical symptoms, and is it a variant of concern, or is it a variant that you need to keep your eye on? So I'm not aware on our chat groups of any current concern around the Cameroon. Maybe within the next few days I would know more, but for now I don't think it's a problem in South Africa. Definitely not.
But is there a large part of the problem that we in India must
of the patients that we are seeing?
But ma'am, is there a large part of the problem that we in India must confront, that across Africa, including South Africa, vaccinations haven't kept pace with the other parts of the world? About 26% of your country fully vaccinated, and that is a danger, isn't it?
Yeah, it is. It will always be a problem in South Africa. We have only been able to vaccinate 44.89% of our adults above the age of 18. And that's very low rates if you compare it with the first world countries. Mm-hmm. We are trying very hard to get people to get vaccinated. The problem is the Omicron, a lot of people has been infected with Omicron without having really very severe symptoms, so that what happens then, a lot of people feel that their immune system has been triggered now by getting Omicron, and therefore they will wait before they go for their next or for their vaccines going forward. But it's always a gamble that you take, because you never know what variant would come onto the scene going forward. So for me, 2022, I think it would be a watershed year regarding your viral infections or the COVID-19 variants. We will this year still see what and how the virus is going to mutate, and whether that would be better than Omicron, worse than Omicron, we won't know. But always remember, it's not in the virus' best interest to mutate and kill off everyone. That's not in the virus' best interest, because that virus will then eventually also be killed.
Ma'am, that leads me to my next question, because there are doctors who are calling Omicron a natural vaccine, that it's helping build antibodies while offering mild symptoms. Do you agree with them, who are playing down this Omicron threat?
Well, that's a interesting way of looking at it, and I cannot say they're wrong, but it's also a gamble. Again, if you have comorbidities and you are above a certain age, severely overweight, and to try to take the gamble with the mildness of Omicron, you might succeed and you might not. So yeah, I can't say they're wrong, but it's a gamble. I would rather, at a certain age group, rather get my vaccines and then take the gamble with the Omicron.
You know, that's important what you're saying, that don't gamble with Omicron in any form. Finally, therefore, how worried should India be with this rapid spread? Because we are seeing the numbers now, you know, going out of control in the last 48 hours. How worried should we be given what you've experienced in South Africa?
Well, that's the nature of the virus. The virus is rapid spreading. That's what makes it different from the other variants. This is a very fast spreading viral infection. So what you need to do is you need to encourage people to get themselves tested, because the more they are tested, the more you can isolate them. So I'd rather test and have a huge positivity rate, and then know that those patients are taken out of circulation by isolation, then not having them test, and everyone walking around and infecting other people. But again, the wearing of masks, very, very important.
One final question, ma'am, a clarification in terms of age group in South Africa. Was there any particular age group most affected, and were most of those affected by Omicron vaccinated?
So the age groups, right in the beginning, the children were more affected, but for now, the children are fine. We don't have a problem with the children anymore. They seem to be over most of the Omicron. We'll see again as the school starts next week. Regarding the age groups being admitted to ICU or high care, with COVID themselves, would be above the age group above 30, with most probably, in my case, in my surgery, it was above 50 with comorbidities vaccinated. But again, not really very sick. None of them needed to be ventilated. And we don't have any patients at primary healthcare level in the community on any oxygen. We have never prescribed it during the Omicron wave.
So there's good news and there's some not so good news. The good news, as you said, none of your patients needed oxygen and they recovered very quickly. The worry, of course, is that the virus is spreading quickly. Dr. Coetzee, as always, for giving us lessons that India could learn from your experience there in South Africa. Thanks so much for joining me here on the News Today. I'll be back with my good news story and image of the day. You're watching the News Today. News without the noise.